Brenda here with the Hospice Care Plan. We take care of a lot of people in a lot of different settings, and over my career, I used to almost always be exclusively in the home. I would say probably 70% of my patients now are in some type of facility setting, whether it's an assisted living, memory care, skilled nursing. And sometimes I feel like we're walking a delicate balance because in care facilities, they have nurses, they have RCCs, which is called resident care coordinators, they have caregivers, and they are protective of their patients, and they sometimes don't want hospice coming in changing things. And I want to respect their role because they know the patient. They're the ones at the bedside doing the care. They're advocating. They know the families. They know they've watched this patient progress. And then they have some hospice team come in and start changing things on them. So my advice is twofold. One, for the hospice nurse to be aware of that. Always ask their opinion. Ask to see their care plan, what it is the facility is doing. Find out what's working, what's not working, what changes they're seeing. Get them to be part of the team rather than coming in and telling them you need to do this, this, and this. Because it doesn't always happen the way you like it if you're just directing care at them. I think that that's really important. And so that's the first fold. The second fold is if you're a really good memory care manager, RCC, med tech, caregiver, administrator, be open, work with a hospice. The fact is, most facilities have a hospice they like to work with best. It is very important that all patients and their families be asked which hospice they want, and they be informed by all of them. And but they do have preferences. I'm with one facility now, they would prefer to have a different hospice, but the family, their primary doc is part of our system and I'm in there. So I'm having to be really respectful and not make too many changes and go slow and trying to gather them to be part of their team and them to be part of my team. So, and for family members with loved ones in facilities, be aware of this. It's okay to ask a facility who they prefer and then ask their primary doctor, gather information, go to the medicare.gov site to find out what hospices have the best scores, and just be part of that team. So that's my message for the day. Please go to our website, the Hospice Care Plan, or go to the shop page and get a copy of the booklet Nancy and I wrote, the Hospice Care Plan. This booklet tells you what dying looks like, how to manage meds, how to manage symptoms, how to do care, and all of our free videos are included, and it's only $17. Thanks.